Welcome to Teal Talk, an ovarian cancer podcast from the National Ovarian Cancer Coalition. Here, experts, survivors, and advocates share knowledge and inspiration for every step of your journey. Subscribe and follow us on social media at NOCC National. This episode is made possible thanks to the support of people like you and our generous sponsors, GSK, Merck, AstraZeneca, and Corcept Therapeutics.
If you've ever wondered whether polycystic ovarian syndrome, PCOS, endometriosis, or ovarian cysts could lead to ovarian cancer, you're not alone. It's one of the most asked questions that we get, and today we are getting you some real answers. I'm Jennifer McClendon, and this is Teal Talk. And to help us understand this more, I'm delighted to be joined by Dr. Natalie Godbee, a gynecologic oncologist at City of Hope in Atlanta. Dr. Godbee, thank you so much for being here.
Thank you for having me. I'm so happy to be here.
We're excited to talk to you about this topic. So we're going to break up today our discussion in 3 parts. First, I'll have you talk to us about really what these conditions are, and then we'll talk about some of the risks with these conditions. And then finally, what you should know if you do have any of these conditions. So why don't we just start with the basics? These are some words that some people may be familiar with, some may not be familiar with. PCOS, endometriosis, ovarian cysts, and they may sound scary. Could you walk us through what each one of these is independently?
Yes. Let's talk about each one. So we'll start off with PCOS, or polycystic ovarian syndrome. It's a condition that we've known about for years, but we're still learning about it. And previously, it was known to be multiple cysts on the ovaries. And if you were to look on the ultrasound, you would see what we call a string of pearls, because all the cysts would be kind of lined up around the ovary. However, we've learned that it is a metabolic syndrome. And so not all patients with PCOS will have the string of pearls or multiple cysts on their ovaries. They may have an androgen excess, which sometimes can present as a male pattern hair growth or an excessive amount of hair. So they might have extra facial hair, hair on their chest. They might start balding in the pattern that males would bald. We also know that it's insulin resistant. And so some of these patients may be pre-diabetic or diabetic. And you may also notice that they are on the obese side. Not all PCOS patients will have cysts, but some of them will.
A metabolic condition. And you mentioned androgens, and that's hormones, right? So it all comes back to hormones.
Correct. Yes. Hormones rule our bodies. So then endometriosis. Endometriosis is tissue that looks similar to the endometrium. And the endometrium is that lining inside of the uterus. And they present, or when you look under the microscope, you'll see glands and stroma. But these implants can be throughout the abdominal cavity. They can be on the ovaries, the fallopian tubes, any abdominal organ. We've also seen them in the lungs and very rare cases, but it's been reported in the brain. And it's thought that they are transmitted or passed through bloodstream or even lymphatics. So that's how it's able to travel so far.
The endometrial tissue can spread that far and through those ways. I never knew that. Wow.
So now we'll talk about ovarian cysts. And oftentimes I will see patients for ovarian cysts. Again, I'm a GYN oncologist, so most of the patients that I see, they have either a concern for cancer or a cancer diagnosis.
Right.
So the ovarian cyst, I often tell them that it's our body's way of trying to get pregnant. It is normal to develop a cyst on the ovaries every month in a regular menstruating female. That's ovulation. And sometimes those cysts will go away, sometimes they won't, sometimes they'll continue to grow. They can just present in many different ways. And it's our job as gynecologists to look at the characteristics of those cysts and determine what's the risk of this being an ovarian cancer. And so most times ultrasound is what we use for that.
Okay, so that can sometimes view or see those things in the ovaries.
Yes. Yes.
Okay. 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 So you touched on something there that ovarian cysts are pretty much most of the time normal for us to have.
If they have some things going on the inside of it that doesn't look normal, like solid components, septations, nodularity, or just certain size of it too, that's not normal.
There's normal cysts and then abnormal cysts.
Correct.
Okay.
Correct.
And so, yeah, and that brings up a question that I've heard before in talking with individuals of borderline cysts. So I've talked to some individuals who've had cyst after cyst after cyst, surgery after surgery after surgery because of the symptoms. And sometimes they come back as a borderline cyst.
Yeah, so I've seen quite a few patients with borderline tumors. They are also called low malignant potential tumors.
No.
And so, I mean, and just keep in mind that we use the word tumor, but it doesn't necessarily mean malignant or cancer.
Okay.
But they're benign tumors as well, right? It's just a collection of cells. So low malignant potential or borderline tumors. I usually describe it as the cells are not really normal, like a simple cyst, but they're not invasive cancer either, like your typical invasive ovarian cancer. They're right in the middle, right on that border. So that's the name, borderline.
Okay.
But sometimes they can behave like an ovarian cancer. So we'll treat them that way. We stage them that way surgically. They're known to come back. And when they come back, there is a small chance that it may be an invasive cancer. So that's why we follow those patients so closely. So that if it does, yes, we can accurately diagnose it.
Okay. So those who get these borderline cysts or benign or borderline tumors, right?
Yes.
They can come back repeatedly and in some cases be treated as an ovarian cancer if it's looking that way. Okay. Interesting. All right. So for those who have these conditions, whether it's a cyst or endometriosis or PCOS, does this put them at higher risk for getting ovarian cancer?
That is a very good question, a very common question. Of course, no one wants to hear the word cancer. So anytime we have anything that's abnormal, our mind starts racing and thinking, could this be a cancer? So that's a good question. With PCOS, that one is really more of a hormonal issue. A lot of times those patients will not have regular menstrual cycles. They may even be only a few times out of the year or may not menstruate at all. So these patients have an excess amount of estrogen, and we have to protect the uterine lining because then they're more at risk of an endometrial cancer.
Endometrial cancer.
Yes, endometrial. So not so much of an ovarian cancer. They're more at risk for endometrial, which of course that can be a whole nother podcast where we can talk about all of that.
Absolutely.
So yeah, PCOS, not really related to ovarian, more so endometrial. And then endometriosis. So this one, we've learned recently in the past few years that there is a correlation between endometriosis and ovarian cancer. And previously, some years back, when we would get ovarian cancer pathology back, the pathology report would say, this is ovarian cancer, this is the cell type, such and such. But nowadays, I've seen quite a few patients who have ovarian cancer, and on the pathology report, it will list that it's related to endometriosis. And so, they spread the same way. Those cells overturn and become an invasive cancer. And it's mostly the epithelial type ovarian cancers that come from endometriosis.
The more common type, right?
Correct. There is a tenfold increased risk of ovarian cancer if a patient has endometriosis. It's definitely a link there.
Okay.
And then ovarian cysts, they won't always lead to an ovarian cancer. It's normal for our bodies to make cysts. If you happen to be diagnosed with a cyst, it's definitely something that you want to follow up on. just to make sure that there are no complex components to it and that it's not continuously growing. Their lab values, physical exam findings, symptoms that will go along with ovarian cancer to kind of help distinguish what a normal cyst would be versus something that's more concerning.
That's really helpful to know. Okay, great. So not as much of a high risk with cysts and ovarian cancer, but for sure with endometriosis. So are patients with endometriosis followed more closely as well then?
It depends on the symptoms that they're having. Those who have quite a few symptoms, yes, they will be followed closely. And I would encourage patients, make sure that you're in with a gynecologist because they're going to be the ones who follow you, who treat you, and let you know if there's something that's worrisome there. If you do have endometriosis, just make sure you're continuing to get annual exams so that if something happens to come up, someone is able to tell you. Yeah.
Yes, perfect. Well, I hope that you're still here with us as this next part is going to be really helpful. Now we're going to kind of switch to really what to really do with all this information. So for Dr. Godbee, for someone listening or watching who has either of these conditions, what can they do about it? What should they do next? What would you recommend?
Again, make sure you have a gynecologist
Yeah.
and then make sure you do not skip out on your exams. Even though you may feel well, sometimes the gynecologist, when they do their pelvic exam, they can feel cysts. And so that might lead to additional workup with imaging labs and those things. So that in that sense, we may be able to catch it early if something is developing there. But definitely know your body as well. Know what your baseline pain is, know what your baseline menstrual cycle is like. And when things change, make sure you report that to your gynecologist so that they can do further workup.
Perfect. Yeah. Know your body, report your changes. There's a difference between knowing your symptoms, but actually taking action and reporting those symptoms, right? So that's the important part.
Right.
Make
Sometimes
sure-
we get so busy that we neglect our own bodies and we just have to pause and take care of ourselves.
That's right. Really important there. I'd like to ask another question regarding going back to maybe some of the symptoms, if you don't mind. So for someone who has, say, endometriosis and has the pain that can come along with that condition, how is that pain with endometriosis different from maybe ovarian cancer pain? Or could you speak to maybe that, like if someone has endometriosis and they're having the pain, like what is there anything different in the types of pain, or would it be mainly in just the other symptoms as well?
Yeah, that's a very good question. Endometriosis, it's hormonally driven. And so a lot of times you may notice that the symptoms are cyclical and coming every month when you're having your menstrual cycle.
Right.
But not for all patients. Some patients will just have a continuous pain, and it just depends on where the endometrial or endometriosis implants are. And what I usually tell patients again is, okay, know what your baseline pain is, know where your pain typically occurs. And when that starts to change, if the pain increases, if it starts to last longer, then definitely let us know.
And can you speak to some of the common ovarian cancer symptoms that should be recalled?
Yes. So if some of the ovarian cancer symptoms start to come up, then that would be concerning as well. Most of these patients will present with like bloating, changes in the bowel, bladder, nausea, vomiting, weight loss, decreased appetite, fatigue. Any of those things might be a sign that a little bit more is going on.
More is going on. Yeah, that's
Yeah.
a good way to put it. Yeah. Yeah. And unfortunately, as you know, these are so hard to sometimes really kind of detect because they can mimic so many other challenges that we face every day as being a woman in our bodies. So,
Yeah, it's true. I hear patients all the time who come in, with those symptoms, but they went down the GI route for workup. And then
Sure.
finally, when the GI came back negative, they said, okay, let's do a CT scan and see what else is going on. So, and I tell patients, continue to advocate for yourself, right? You know your body. If what we're treating you with is not working, or if the images that we collect is saying no, or they're negative, continue to say, okay, but something is wrong. Let's do something else to
Right.
figure out what's going on.
And that is perfectly okay. They are your employee. That's what I used to say.
Yes, yes,
And
we are. We're here to help you.
Wonderful physicians as yourself understand that. And that's really key to advocate. I'm glad that you brought that up for yourself and to continue to ask questions and push when you know something isn't quite right. Absolutely. Yeah. Thank you so much. I know this is a quick overview, more to come, but thank you so much for sharing your insights and support with us today. It's been very enlightening. So we thank you very, very much.
Thank you so much for having me. I really appreciate it.
Thanks for listening to this episode of Teal Talk. We'd love your feedback. Take our quick survey linked in the description or drop a comment with your questions and topic suggestions. For more information about the National Ovarian Cancer Coalition and our mission, visit ovarian.org. Until next time, stay informed, stay empowered, and take care.